All right, so I'm here today with Wes Harrell. Wes, would you like to introduce yourself?
Sure. I am the Director of Engagement at Siloam Health. Director of Engagement sounds like a fancy title, but basically I get to oversee church and community engagement, and a part of our development team trying to raise the funds necessary to carry out the ministry that we do, which is healthcare. And Siloam is a nonprofit Christian-based medical clinic here in Nashville that serves uninsured patients and really those that have kind of fallen through the cracks of the healthcare system and don't know where else to turn. And over the years, that has grown to be incredibly diverse. And so the majority of our patient populations are immigrants and refugees.
It's really cool. So how have you seen Siloam Health Center having to adapt during COVID-19?
Oh, man. Well, as a medical clinic, obviously, we are, kind of addressing COVID on the front lines. And so quite a few changes. For me personally, I have been working from home ever since really the pandemic hit and quarantine kind of started. And most of our administrative staff are doing the same. But obviously, our doctors and our nurses and our patient relations kind of medical and clinic team are still having to go in every single day. We serve patients with primary care, but many patients are either showing up with COVID symptoms or showing up asking for testing, trying to get more information, et cetera. So a couple of kind of immediate things that we've done. We created a kind of new volunteer role where non-medically trained folks can come and serve appropriately masked and all of those things, taking safety protocols as best as we can, but really to screen anyone entering our building for potential COVID. And what that means is they ask a series of questions, whether that's a patient, whether that's a staff member, a volunteer, or even a delivery truck driver. Before they can enter our clinic, we're going to ask a few questions. And at the end of the day, if they have any symptoms whatsoever or any worry that they may have been exposed to COVID, then we're going to kind of redirect them to a specific COVID screening area or station where our doctors and nurses will kind of take it from there. And that's as an extra layer of protection for our other patients who don't have COVID symptoms, as well as just our own staff team. And so that's the main adjustment for us. I think the other thing that kind of happened simultaneously is we had already made plans to open our first satellite clinic location in Antioch. And so the timing of that felt really weird. It felt kind of like, oh man, like, is this really the right time to be doing this right now? But kind of an affirmation of God's provision and God's perfect timing. That location in Antioch is really the hot spot for COVID in Nashville and in Middle Tennessee. And so the immigrant communities, especially in that area, have been hit at a much higher rate than the rest of Nashville. And we kind of saw that as, again, affirmation of God saying, no, we need you there. We need to be in that community and really reaching out to those that don't know where they can turn in this time of need. And so it's been a blessing for us to kind of step into that in faith and see God follow through. And we just opened that clinic in June, so it's still very new, but already the response from the community has been overwhelming and in a positive way. And we're hopefully getting more, not just seeing patients directly, but also more health education out into that community about how to address COVID.
Do you have any stories of transformation to share with the congregation?
Yeah, so man, it is. I was just talking about this with a coworker yesterday, and how not being in the clinic and kind of living and breathing it every day, it feels like a little distant these days. So I don't get to hear those patient stories quite as often and kind of see that side of things on a daily basis. But I'll share one that has always touched my heart. We started a program a few years back that Brentwood UMC actually has had some connections with, but it's called Nashville Neighbors. And basically, we take newly arrived refugee families and place them with small teams of volunteers, mostly from local churches, to walk alongside them for 6 months to kind of help them adjust to a new culture and a new life, but also to teach some very basic health topics along the way. And one of my favorite stories that came out of that program is we had this beautiful family from Afghanistan, a Muslim family. The father had served as an interpreter for the military with the U.S. troops on the ground in Afghanistan. And because of that, their lives and their families' lives were kind of put in danger or at risk for those that opposed that. And so they were relocated to the United States for their safety, wound up in Nashville, and got paired with a church team through this Nashville Neighbors program early on. At the end of their 6-month commitment, I went and actually did a home visit and met with this family and talked to the father and just asked how it went, and kind of sharing about his experiences and reflections. And I think what really resonated with me was that this man, who was a Muslim man, said to me, the team leader of the volunteer team, he said, "He's Christian, I'm Muslim, but we are now brothers." And I think that, our hope would be that seeds are planted, and someday that the truth and the grace of Jesus would stand and would be a reality for this man and for his family. But that's not our job. That's the Lord's job. And for us to just be faithful to the calling. And for this volunteer team to walk alongside this family in such a beautiful, tangible way. What's cool about this story too is that his wife got pregnant during the time that this team was working with the family. And then the team leader's wife got pregnant pretty close together. They have since had their babies, but they threw a joint baby shower together. Now their kids are going to kind of know each other and grow up together. And even though that 6-month program has long been over, they've built a relationship that I think will last a long, long time. And that father of the Afghani family has since returned to Siloam to serve as an interpreter for other families in his community in this program. And, we sometimes have hesitation from folks from the Muslim community to sign up or participate in something like this because they know we're a Christian clinic. And now he can be an advocate for us and say, no, they're not trying to convert you. They're really there to be your friend and to help you with some important health topics along the way. And so I just love that glimpse of really the kingdom of God and this example of really planting those seeds and just loving on people and letting God do the work from there.
That's really powerful. It's a good story. Can you tell me a little bit more about the volunteer roles at Siloam Health? I know that y'all really depend on volunteers.
Yeah, absolutely. So when COVID first hit, we obviously had to kind of pull back a little bit. A lot of our roles were put on pause altogether. But then, as I already mentioned, we created a brand new position that we didn't previously have to more directly address this pandemic that we're all walking through together. Now that we've kind of got a little better grip on reality, if you will, and kind of have systems and protocols in place to protect everyone, we have opened it back up for volunteers of other roles. And so the main ones that we're recruiting right now, Spanish and Arabic interpreters. That's a huge need in both of our clinics. And then clinic support, which does not have to be anyone that's medically licensed. A lot of times undergrad students that are maybe wanting to go to med school, wanting to go to nursing school or something in the medical field is a great opportunity for them to come and get some exposure in a clinic setting without having a certain licensure or anything like that. But they do a lot of support for us, cleaning exam rooms, stocking supplies, making phone calls to patients, checking voicemails, lots of tasks like that that are super helpful to our clinic team to free them up to focus on the patient care. And then in the medical side of things, we do have volunteer nurses. Those are currently still on pause for new signups, but that will be opening back up very, very soon. And then volunteer specialists. And so for context, our staff providers, doctors and mid-level providers, they are going to do primary care. But if a patient needs follow-up with a specialist, let's say an orthopedist or a cardiologist or a dermatologist, we have volunteer specialists that will actually come on site maybe once a month for a 3 or 4 hour shift and see patients that need focus in that specialty, which is such a gift to us. And so if you guys have specialists in your congregation for ways to kind of give back to the community and to maybe tap into more of the heart of why they went into this field in the first place, this is a great way that they can come and serve with us and really meet the needs of our patients who probably couldn't afford to go to a specialist dermatology office on their own, et cetera. Mm-hmm. And just so you know, all of that information is on our website, siloamhealth.org, Siloam, SILOAM, health.org. And then there's a volunteer page on the website that has an application that people can fill out, has information about what roles we're looking for right now, et cetera.
Awesome. Cool. Following up that question, how can Brentwood UMC support Siloam Health going forward, especially during this crazy time?
Yeah. So a couple of things. One, volunteering. So individual volunteer opportunities there are some real needs right now. I think prayer is one way that you guys have faithfully supported us for many years. And so keep those coming. More specifically, praying for protection over our clinic team as they do serve patients with COVID. What we have done a great job of so far is having 0 exposures to our staff team in the clinic setting. Does not mean any of or none of our staff have gotten COVID or tested positive, but it's been our administrative staff that have in other settings, but not through the clinic setting. But continue to pray for protection for that. Pray for our administration staff that we would, even as we're working from home, still feel connected to the mission, connected to the culture, and that our team would be bonded. And then specifically for the new Antioch location, that we would really just ingrain ourselves in that community, and that the folks there, particularly from the Hispanic community and from the Arabic-speaking community, would that word would travel, and that they would realize that we are a resource for them to now come and be seen. At that clinic specifically, they don't have to quote unquote apply to be a patient like they do at our normal clinic at Siloam Health Melrose. But at Siloam Health Antioch, we actually take walk-ins as well that are not established patients. Other ways that we've had folks, and particularly churches, support us during this unusual season, donated meals. And we've had quite a few folks bring a meal to provide for our clinic team. So it's one less thing that they have to worry about, and really just a nice gesture. Thank you to them for the hard work they're doing on the front lines. And then aside from that, we're always open to creative ideas. We've had folks donate masks that we can, cloth masks, or even hand make cloth masks that we can give out to patients. We've had folks donate hygiene supplies and even little like toys and stuffed animals for some of the kids that come through. And those little things go a long way. What I would say to that more specifically is, if you're interested in asking or exploring a specific kind of in-kind donation, you can reach out to me directly, and I'm happy to kind of field those and let you know what's needed, what's not, et cetera. And you guys, I'm sure, can share this, but my email address is Wes, wes.harrell, HARRELL, @siloamhealth.org.
Right. So my next question is actually about prayer. I'm glad you mentioned that. So how can we be in prayer specifically for the refugee and immigrant population?
Yeah, as I alluded to already, those communities are getting hit by COVID at a much higher rate, and there's a lot of factors that go into that. One is just the sharing of information and really just education in those communities. Because of language barriers, sometimes there's a delay in getting accurate information out to the masses. But then on top of that, a lot of folks in those communities are working hourly jobs. They're providing for their families in a way that they aren't able to just stay home or take a break from kind of the normal routine. And so they are therefore just at a higher risk to be exposed, obviously. And so I think as we pray for those communities, praying that health education um, would have clear messaging and that would get into the hands of more people, whether that's through Siloam or other resources. And then specifically for us, we have a what's called a community health worker initiative, where we have trained and hired lay health workers from some specific immigrant communities in Nashville. Currently, we're working with Hispanic, Egyptian, Burmese, and Bhutanese communities. And we've got lay health workers that are now employees of Siloam, and we are training them and equipping them and then sending them back out to their community to really do health education that's specific to that community. And not us coming in saying, here's what you guys need to know about, but asking, hey, what are the struggles that you guys are facing? What are the questions you get when you're out talking with folks in your community that they are really unsure of or need to learn more about or facing this particular struggle? And I think that grassroots approach has been really, really incredible to see not only warrant success, but really intentionally connect with those folks on a personal level. Hey, let me tell you about some healthy eating habits, but then actually let's go to the grocery store at the market that you shop in, and let's walk through the aisles and actually talk about these different things. So it's practical, it's tangible, and it's really led by their own community.
Awesome. So is there anything else you'd like to share during our time together?
Man, I think that for us, it's been a heavy season, I think, for the world, for the United States in particular, and even a heavy season at Siloam. But we have been reminded time and time again of God's faithfulness, and even in the midst of just a really, really difficult situation, how God is still being glorified in the midst of that. And so for us, as a healthcare organization, to have this opportunity now to speak hope into the lives of our patients is really a unique privilege. And I was talking with our behavioral health consultant actually this morning, and she said that she just feels this heaviness from our patients. Usually she'll get some that are really kind of depressed or going through some trying times, but she just feels like it's like every patient that she's talking to is really struggling even more with the mental health side of things than maybe the physical. And sometimes when we're talking about COVID and the pandemic, we tend to really focus on the physical side of it and the impact that has on people's health. But we forget and maybe neglect that mental health aspect as well, and the spiritual care that's involved with that. And so for us to really speak God's truth and God's grace into the lives of our patients that maybe aren't feeling that right now, and to walk with them through that difficult season, I think is such a unique privilege for Siloam, and something that we absolutely never want to take for granted. And so I just ask that you guys continue to pray for us, that we would be good stewards of what God has given us, and that we would really shepherd folks in the way that he would lead us. Lastly, I'll just say, we are so grateful for Brentwood UMC They've been a faithful partner for many, many years now. We've had lots of volunteers come through, lots of, I'm sure even some board members at times, staff probably have even served with us that attended there. The financial support that you guys faithfully give us on an annual basis really allows us to go deeper with our patients. And we are grateful for that. We do not take that for granted. But your prayers are what carry us through. Your prayers are what really give us that kingdom impacting moment with our patients.
Awesome. Well, I don't really have any more questions, but I very much appreciated this time and getting to talk to you and learning more. So thank you.
Absolutely. Thank you.